Yo, abusiafo enenso mema obi bera koba eba okrobia media. Okrobia media se na bia meka no ye bopene ona obetimi ahye nkran. Na ene bia me woi eye Tropical Institute ewo Belgium, Antwerp to be precise. When she dey make course was say COVID no ene the vaccine na aba no. Dodo na adwen yo montanta bebre. Ntene ma bopene omo ye enro no anaso mo sa vaccine ho nimde ewo institute ha wanya abrama mnu so obekyerekere yen ene me bi higher adwene bi anso no watimi akyerekere ma won so wate ase ndi se bredu so so ko de a na wo nsuro so be wo de because krum ha de ndi amafo so mbe wo na so ene mfisa yemie we no na wakyerekere ama won so wate won ho ase. So lovely people, as I said today, because of that our conversation is going to be in English, because the doctor is not a Ghanaian. So as you all know, I just want to divert it. Welcome our doctor. So doctor, we welcome you to Okrobia Media. Yeah, our media, the name is Okrobia Media. And today we came to you to know much about the vaccine that is going on. So please, we give you the opportunity. And you mention your name to us. And you tell us who you are.
Thank you very much. So my name is Dungu Charles, and I originally come from Uganda. I came in Belgium some years ago. I came to study in the Catholic University of Leuven. So when I finished my studies, then I got to work. So I did my study in Anthropology, and so a master's degree and a PhD. Afterwards, I started working. I worked in the Netherlands, in The Hague, in development organizations. And then afterwards, also in 2 hospitals in the Netherlands as a health counselor. And then I came to work here at the Tropical Institute. So I'm not a medical doctor, I'm an anthropologist.
Anthropologist.
Anthropology is a science that studies human beings. So we study human beings as human, which means aspects of behavior, but also aspects mainly of culture. Okay? So my field is mostly how, for instance, culture, people's culture and the cultural beliefs may affect their healthy behavior.
Okay.
So somebody who comes from Ghana does not understand the health and the medicine in the same way as somebody who comes from China or Japan or Belgium. So these are different ways of understanding health, and that's how we tackle our messages. We try to configure them to people's cultural background. So that is in fact my specialty, to try to frame healthy messages to people's cultural background. So I'll give an example.
Yes, please.
People from mostly African countries, maybe also Asia and Latin America, we have a tendency to understand issues with the reference to the spiritual world. So we could easily link any disease also to the spirits.
The spirits, yeah.
So when, for example, a person who comes from Uganda, where I come from, becomes ill, gets sick here, instead of thinking that I have a bacteria or a virus, there's also tendency to think that maybe there is something behind it. Maybe somebody has sent me this. Maybe the spirit of my ancestors. Okay, so this is what, as medical, we advise medical people here, the doctors and nurses and all people who give health care, that please take these things seriously, because this is what people believe.
Okay.
Don't just dismiss them. Explain to them, okay, it's a virus, it's a bacteria, but if you have other beliefs, well, maybe first put this in the bracket, first take the medication and then the rest will come.
Let's talk about the COVID-19, what they call coronavirus. First of all, what is coronavirus?
Very good question.
Thank you.
So, COVID-19 is a family of what is called the coronaviruses. Okay? An example, it's so, coronavirus or corona is a virus that mainly attacks the respiratory system. So there was, for example, the SARS, which broke out in the Middle East. And there have been many variants of the coronavirus. But then there is the one which broke out in Wuhan in 2019, in December, that was it. And then, of course, it's a virus which jumped from animals to human beings.
Oh.
And then it started attacking the lungs, the respiratory system of human beings. And it's very, very contagious.
Okay.
So how does it come to infect other people? So it crossed from an animal which is not yet identified. The scientists are trying to look for where it came from.
The
which
specific animal? Or
yeah, it's not yet known. So don't start speculating. It's known it's from an animal, but we don't know which one.
How did they know it's from animal?
Well, because it wouldn't come anywhere else. It cannot be from a plant.
It cannot be in the air also?
No. The virus needs to have an inhabitor.
Okay.
And according to its characteristics, it can survive in animals.
Okay.
Okay? And then from animals, it crossed to human beings. And when it crossed to human beings, it adapted to the human condition. And of course, viruses, they need to survive, but their survival is very destructive. It attacks the respiratory system. And then when your lungs are destroyed, it becomes filled with water. You get very acute pneumonia. Pneumonia is when your lung system is filled up with water and you cannot breathe.
Yeah.
So people who die of COVID-19, of coronavirus, die of suffocation.
Okay.
So that's why it's very, very dangerous. So it's contagious, as I say. It is transmitted through droplets which come from the mouth and the nose. That's why we're wearing masks.
Okay.
So that I am talking, but the droplets are controlled by the mask.
Yeah.
Okay? So in fact, it's very simple to explain the function of a mask. I am talking, but the droplets, when I'm talking, cannot jump to you.
Yeah.
Or if you are seated outside and you don't have a mask, you have to keep a good distance so that the droplets which you come out of your mouth when you are talking don't go directly to you, the person in front of you, the persons in front of you, for you to breathe them in. When you breathe them in, then you get the infection. That's one. Two, it can be transmitted also through touching, because normally we cough when you don't have a mask. Some people put their nose, their finger in the nose. So our hands are carriers of this virus. So when I have touched my mouth, my nose, and I am infected, I come and we say hello, we shake hands, you carry it. That's why shaking hands is no longer recommended during this COVID time. That's the second. A third one could be also through the cup. I drink in the cup. Of course, I have left there my saliva. And when you have this virus in your body, all the liquids, the mucus, the saliva, they're all full of this virus. So that's how it is transmitted. Very, very fast. And for example, if I touch my mouth, my nose, and whatever, I touch a table, or I touch a bench outside in the park, and then somebody else comes and touches it, this virus can survive for over 72 hours on the surface.
Oh.
So you touch it, and then you go away with it. And then you become sick.
Okay.
But not everybody who gets it becomes sick. COVID-19, or this sort of coronavirus, mainly affects older people. Why? It's because their immune system is lower.
Okay.
That's one. So people above 60, normally they are very fragile. They can die of this virus. Two, it affects people who have already underlying diseases.
Okay.
So people who are diabetic, people who have hypertension, people who have other underlying kidney problems, for example, or people who have just been diagnosed with cancer.
Okay.
So whoever has a lower immunity is very at risk of dying or becoming very severely ill of COVID-19.
Okay. All right. Thank you. So what can you do to increase or to boost your immune system if you want to be protected?
Well, that's a very difficult question. I think which I cannot answer because I'm not a medical doctor.
Okay.
But common sense that immune system is weakened by diseases. So if you are diabetic, for example, or if you are older, well, you can boost your immune system, but not a lot, because you're already old.
Okay.
Okay. So I mean, eating healthy is one thing to boost your immune system, and there are foods, I don't know which ones, which also help to boost it better than others. And then there is also sports. You have to move, you have to be active, you have not to drink alcohol, a lot of alcohol, smoking, all these things weaken our immune system. So we call that one in general healthy behavior. You behave in a healthy way, you eat healthy, you behave healthy, you move enough, and you avoid toxic things. Like too much alcohol, smoking, and so on, and other substances.
All right, that's very good. Okay, let's go back to COVID, because now we are hearing that we are having a vaccine, which will help to calm down this spreading of the COVID. So now, so far, how many the vaccines have you gotten so far in the world?
Well, maybe I think before answering you, I would say, why to be vaccinated at all?
Yeah.
That would be the first question.
Yeah.
I think getting a COVID-19 vaccination is really recommended for everybody in the world, except special cases, which maybe we shall explain later, because a vaccine, the COVID-19 vaccine is not the first vaccine in the world.
Okay.
There have been many vaccines. Yeah. So what is a vaccine?
What a vaccine? Yeah.
A vaccine is a medication, a substance that is made by the use of a virus itself, of parts of the virus, okay? And what is its function? It boosts the immune system, or it trains the immune system to fight the virus for which it has been made.
Okay.
Example of vaccinations, you have the measles, okay? You have the polio, you have the papilloma virus, you have the hepatitis B virus. So there are so many vaccines.
Has AIDS also got the vaccine?
HIV, you mean?
HIV, yeah.
Not yet. There is not yet a vaccine for HIV.
But that must be there for long ages. Why not about this recent?
It's a very complex disease, virus, I mean, for which we cannot go into discussion now. And that is also my field. Yes, HIV is still, it is still one of the threatening viruses in the world. It can be treated, it can be controlled, I mean. So people take medication, and then the viral load, the virus is reduced, so they don't become sick, and they can live their normal life. And now, they even don't transmit the virus, those who take their medication. They no longer pass on HIV. But let's come to COVID.
Okay.
So why should you be vaccinated?
Yeah.
Because COVID-19 up to now has no medication. There's no medicine, approved medicine for it. The science researchers have tried a lot of antibiotics, but all of them can just reduce the symptoms, but none of them can really eliminate it completely.
Okay.
It's like a flu. Its time comes and then it goes by itself. Okay, the immune system fights it, and with the help of medications, antibiotics, but for some people, they don't succeed. That's why people die. Eh? People whose immune system is weakened. Okay, so when you get a vaccine, the vaccine boosts your immune system, so that when you come into contact with the virus, as I said, you come into contact with the person who has the COVID-19, or it goes through your mouth. When you had got a vaccine, your immune system is already trained to fight against it. So as soon as you come into contact with the virus, surely you get it. It comes to your body, but your body is prepared. It fights it and it stops there. So you don't become sick.
All right.
So in fact, the COVID-19 vaccine is the only way we have now, the sure way, which will stop the people from dying.
Okay.
Yes. Yeah.
So does it mean if you take the vaccine, that means the virus in you, whatever it is going to stop, or what? Or I don't get it.
A very good question.
Yeah.
Very, very good question. In fact, you come in contact with a virus when you are not vaccinated. The virus comes in your body, starts multiplying mainly in the respiratory system. For people with a weak immunity, then you have problem with breathing. People who are strong, like young people with a healthy immunity, they fight it. Some don't even become sick. Okay, but with the vaccine helps even those with a weak immunity, because their immune system is boosted, and then it's prepared to fight the vaccine. So you come in contact with it. It does not mean that the vaccine protects us from getting the virus. No. You get it, but you don't become sick.
You don't become, okay.
Yeah, you don't become sick.
All right. Because of time, and I just want to make things brief so that people, because we have some questions that will help us to answer them. Right. So let's start from the number of vaccines that we have accepted in the world. How many vaccines so far?
Perspective, that is Western Europe. They are 3.
Okay.
So which were up to now, here at least how authorized. You call it authorization because it goes through the protocol of scientists, and then the scientific body examines really what the laboratories have made, and then the experts say, okay, this vaccine is safe. So you have the Pfizer, which is a German-American company which has made this vaccine. So this one was the first one to be authorized. It's they say it's 95% efficacy, strong, I mean in the layman's language. Then you have the Moderna. Moderna is also a an American pharmaceutical company. So it has also made a vaccine, almost the same type with the Pfizer. It is was also recommended and authorized. You have the AstraZeneca, which is a vaccine developed by the University of Oxford in the United Kingdom. Then you have recently the Johnson & Johnson vaccine developed by the Johnson & Johnson pharmaceutical, and our institute is also was part of making the trials. It's a very good vaccine, especially for African countries, because it can be stored even in a normal refrigerator. But there are other viruses. Vaccines, for example, China has a type, I don't know exactly the name. Russia has a vaccine also. So we can talk about 5 at least. 5 authorized and now being used vaccines.
Okay. My question is, this pandemic is global, right? So why is it that we don't come together and make one vaccine that which we know that this one is, we base it on this one, but we are allowing different vaccines? Because it might be a challenge, and a time you come, this one say my own is good, my own is good, my own. Why not one vaccine that the whole world should accept it, but instead numerous ones?
I think the answer lies in your question, because you said the COVID-19 is a global program, so there is no one company that will be able to make the vaccines for the whole world.
Okay.
So we have numerous because of the magnitude of the pandemic. Pandemic means the disease is in the whole world.
Yeah.
So we need a number of companies and manufacturers to put hands together, and that's what happened with when it was decided, okay, the only solution to this problem is a vaccine. So different scientists, different pharmaceutical companies put themselves to work. So they developed these different vaccines, and you can even see with the 1, 2, 3, 5, we don't even enough supply. So one would never be sufficient.
Okay.
In fact, we need more.
Okay.
Because the world is big, the population is billions. I don't know.
Yeah. The reason behind the question was we were here when we were even having 3, like the Pfizer, like the Moderna, and the AstraZeneca. But later on, that issue came that the AstraZeneca, people, some countries are rejecting it.
The doubts about the AstraZeneca.
Doubts, yes.
Yeah, the AstraZeneca came into doubts because it caused in a very, very minimal number of people who received it, the blood clots, and some people died. But these cases are very, very minimal. They are talking of 1 person in 10,000. So that's, I mean, it's not that this life is not life, but in numbers, it's very, very small. So these, we call them special side effects of a vaccine. All vaccines have side effects. And when the vaccines are fabricated, the makers, also the pharmaceutical companies, also, they don't know all the side effects. Some side effects may come which were not awaited, which are not shown in the clinical trials. Okay. Example is these blood clotting. So the doubts, in fact, was about this case, but now it has been well studied, and they think that the advantages of taking the AstraZeneca COVID vaccine are bigger than not taking it.
Ask you, how would you convince somebody to take it?
Very good. Yeah. That's a very good question. That's my work. We are here as health promoters to convince people to take vaccines of all types. Okay? So, convincing people to take the vaccine is listen to their doubts, their questions, and their fears, and address them. That's 1. 2, give the correct information. Okay? Correct information means that what is this virus, can it be cured or not, and what is the best way to get rid of it, okay? So then you say the best way is to get vaccinated. But when, of course, people then have hesitations, then you have to address these hesitations. Okay. That's the only way. And when you are convincing people, there are no stupid fears, there are no stupid worries, there are no stupid doubts. Everything counts. Address them. Okay. This is the best way.
Okay, thank you. But if you see on a social media, there are a group of doctors also from Belgium here who are also speaking against the vaccine.
Yeah.
Where from them? Or have you, I know you have heard or seen them.
Yes, I do have seen them.
So what's their mission or their motive behind it?
That's a very good question. as long as vaccines existed in the world, there has also been every vaccine which develops what you call the anti-vaccine movement.
Okay.
These are just people who come with some with religious motives. I don't know, some with I don't know which other motives, which just stand that no, the vaccine is bad, and they convince others not to take it. And they try to give all kinds of explanations, also taking advantage of people's ignorance and people's worries. They catch where people worry, and then they use this as a tool to convince people not to be vaccinated. So it's a it's a global movement. It's very much in the United States, but it's everywhere. We have, for example, here we have a group that is trying to go in our outreach to give the correct information. But we have also a research team that is researching on people's hesitations and trying to advise doctors, policymakers, how to address these ones.
All right, so let's go to the questions that people brought to me when I put it out there. And these questions from people, what they want to know about the vaccine. So somebody asked me that is the vaccine for everybody? That's about the age-wise. It's for everybody, the vaccine?
No. Now, currently no. Because up to now, the vaccines are recommended from the oldest, I don't know, let me say, the oldest people live up to 90s and so on, or 100, to recently. It had been to 18, but now there are suggestions that it would go up to 16, okay? So the kids, it's not yet decided. Maybe it's coming. So kids are not yet on the list, but it's not for all ages. So and it's certainly not for everybody.
Okay. All right. So let's say for the kids, are they going to have their own also? Because you cannot take the one that can be used for a child of 5 years or a child of, let's say, 4 years. Are they going to have their own as children vaccine, or they're going to have our own as the same one I'm going to take?
Currently, no. Currently nothing for the children. But I mean, one of the reasons is that also COVID is not as a danger for kids.
But kids are dying also.
Well, in very rare cases.
Yeah.
Very rare cases. Children who have very weak immunity, for example. But generally speaking, in all the research that has been done, it's a virus that is child-friendly. So children get it, some of them don't become sick at all, and so it's less dangerous to kids.
All right. So is the vaccine compulsory?
No, it's not compulsory, and that really was very, very well made clear by the World Health Organization, and all countries are making it very, very clear. Much as the vaccine is very, very advantageous, we are not going to oblige anybody to take it. So
what about, let's for instance, we are 100, let's say your percentage is 100, okay? And the people, maybe 80% decide, since it's not compulsory, we are not taking it. How can we chase this COVID away?
Now, I think that will not happen, because at least experience has shown us that the greatest majority of people, at least in each country, 50% of the population want to take it. Because people want to go back to normal life.
That's right.
And people don't want to become sick and die. Yeah. So those who remain hesitant, I mean, they could be 30%, 50%. Those we shall convince them slowly. And the principle of the vaccine is that if 70% of the population are vaccinated, normally the epidemic becomes better. The majority of people are vaccinated, so those who are not vaccinated, it means there is less circulation of the virus, so they can survive.
All right.
So when you reach the herd immunity of the 70% plus, then it will be fine.
So far, how many percentage have you got so far in Belgium?
Well, the last how do you say, the last numbers I saw was, I think, 16. We are not very far.
16.
16%. So we are 1.5 million
My question
of the adult population.
Let me come again. My question is, why are they delaying? Knowing them that this disease can cause something, even you see what has happened, we are not in normal life. Why are they delaying? Why would they call anybody the way we do voting? They bring you, come and vote, come and vote, come and vote. Why don't they do that and let people respond to it and take the vaccine?
I think the problem, my brother, is not that people don't want. Here in Belgium, many people want to.
Yeah, many people are willing to.
The problem is the supply. The supplying system is overworked. It's the whole world which needs the virus. The vaccine. So, yeah, I mean, why is the US ahead? Yeah, because Pfizer and Moderna, they are US companies.
But I think they do some also here in Belgium, in Boom.
But
Which one?
It remains an American company. So
okay.
It's the factory is here in Boom.
Yeah.
But it's not a Belgian company, so we have very less control on it. So we ordered, the Belgian government ordered I don't know how many millions, but up to now the supply is, because Pfizer is supplying for the whole world, so then that's it. The supply is the problem why we are behind. So if for example the Belgian government will decide also to include, which is not I think it is in discussion, to accept also the Russian COVID-19 vaccine, then we will have an additional type of vaccine, then the supply will be higher for sure.
Okay.
Yeah.
And then one thing I heard also is about when you come to Belgium here, they use the Moderna, of which people believe that that one is the best one. And they use it for the frontliners, like doctors and the nurses. Why can't they use that one for everybody in Belgium?
Because of the supply. It is the same answer. The supply. There's not enough doses.
Wow.
There are not enough doses. Okay. So the factories are overloaded.
All right, let's go to the questions. The next one, the person want to know, are there any implications, complications instead, sorry. Complications.
Unfortunately, could be. All vaccines that have been developed for all diseases have what you call the side effects. Okay? But for the COVID-19 vaccines, during the trials, the side effects or complications which were at least shown and which are now shown by people who are taking the vaccine are not very severe. So you have, for example, the fever. You get a fever when you get your fever. You get some pain, for example. You get muscle pain. These were the normal side effects were. But the rare side effects, for example, where people were losing, how do you say, the feeling in their limbs?
We saw some online people.
Yeah. But these are called rare side effects. Okay. And of course, now for the AstraZeneca, we have the blood clots. These are rare, and I want to underline the rare side effects, which come in very, very few cases. But the side effects are mostly for, like any other medication. If you take any medication, it's something external that comes to the body has to react, and the reaction is what produces fever, muscle pain, and other things. The body had to get used to the foreigner in the body. So
why isn't that we don't need to test the person before we give the vaccine, if the blood is okay with it?
You don't need to test the person before taking a vaccine. I don't know why. I don't know why. I cannot answer that question. But I can speculate is that I think since the vaccine trains the immune system to fight the virus, if somebody has been infected, maybe it will help the body to fight better. That's my own explanation. But the medical explanation, I don't know why.
Okay. Another one is, let's talk about a pregnant woman. Will you allow pregnant women to take the vaccine?
Well, according to the recommendations, pregnant women up to now are not recommended to take the vaccine, but there are now gynecologists and other scientists who are saying, well, if we are talking about people at risk, yeah, pregnant women are at risk, because when a woman becomes pregnant, the immune system becomes weaker. Okay, that's one. Two, there are pregnant women who has these what we call other diseases, who are diabetic, who have hypertension and so on. So these also should also take the vaccine. But in general, because in the trials of the COVID-19 vaccines, there are no pregnant women, it's not very clear what could be the effect. But experience has shown, because in the UK they started vaccinating pregnant women, it has shown that there is no problem. But officially, the official recommendation here in Belgium is that pregnant women who want to be vaccinated should do that in consultation with their doctor and their gynecologist.
So what about if now a pregnant woman contracted this virus? What is going to happen?
Well, she becomes, if she has a strong immune system, she will get a little flu. If she has a weak immune system, she'll become very sick. And then the effects, of course, then the pregnancy may be affected, you never know. So it's still a puzzle. That's why gynecologists are recommending that also pregnant women should be vaccinated. Okay?
One question I got from here, the person was saying that the scientist says if a vaccine is produced, it takes at least 5 to 10 years before it can be used on human. Why did they use this vaccine immediately after production?
Urgency. It was so urgent.
But is it true? Is it true that when a vaccine is found like this, you need to take that's five years?
That's the normal procedure.
Okay.
It's the normal procedure, but you remember for the Ebola vaccine, it didn't take that long. Depends also on the urgency of the need for the vaccine.
Okay.
So the need for the Ebola vaccine was so urgent, people were dying, that the test period was cut. Okay. It is for the COVID. The whole world is closed. Everything is standard still. People are dying. So then the trials had excellent results. So the science said, why not? We can maybe reduce the time protocol and start just using the virus. But there was really excellent, very rigorous studies and the follow-up of the development of these vaccines. They are sure that's why they are used. I mean, the World Health Organization or government would never have allowed something that is dangerous to the populations. It means the trials were rigorous and showed that these vaccines are safe.
Are we going to show passport with indications that we have the vaccine before we can travel in the future?
I don't know.
Is it going to come?
I don't know. But already I hear there are countries who have already put this as a requirement. Before you go, like Israel, you have to show a paper, one, that you have been tested, you have a negative result of COVID-19 within the last 72 hours. The second now is that you have been vaccinated for the second time, because there are 2 jabs that have been vaccinated at COVID. That's it.
Okay,
Yeah.
all right.
And another one is that you have contracted the virus and they have been cured. Because people have been cured, they have developed a kind of immune system also. But I'm not a doctor, so I don't go in those details.
Okay. Let me ask this. If in case you want to travel to Africa, and now let's see Belgium like this, we don't know the age, but if you want to travel and you want to have your vaccine, is it possible before you travel?
No.
You cannot give it to you?
The vaccine protocol follows the order that has been laid by the government. I think you know what is the order. So we began with people in the care home, old people and the staff. The second group was all healthcare providers, on the first line, the general practitioners, pharmacists and nurses and so forth. So all hospital staff. The third group was everyone above 65. In Belgium, we are still on the third level. People above 65, but yesterday on the news, I heard that now people with underlying health problems like those with diabetes begin today. So we are a step further. So maybe I think when that group is vaccinated, then our percentage will go 20% or 30%. And then the third group will be people who are working in the public places like policemen, receptionists and so forth. And then they said in June, from June onwards, everybody.
So from June, so everybody can receive letter, or you can just go to the vaccine center.
Exactly. So the reason of traveling cannot give you priority to get a vaccine.
To get vaccine.
You get a vaccine when your time comes. That's it.
And one thing I don't understand is, are they not exaggerating? I think the exaggeration is too much. Sometimes the number of people, they say it on radio or television, they have contracted the disease per day, and if you compare to the population that we have here, meaning that everybody has gotten this thing, because there was a time they would say every day 2,000 people have it. Every day the number was so huge. So telling me that means everybody in Belgium has gotten this COVID.
No, I think I don't agree with that, because they are talking about like 3,000, 6,000, 10,000. We are 11 million.
11 million, yes.
So the number, in fact, in absolute terms, is very small. The problem is that it goes about life and death. I mean, if you have 3,000 people who are, well, maybe 6,000 who are these last days when the numbers started going up, we came up to 4,000. It's threatening, because if there are so many people who are testing positive, it means that, well, you don't know how many among these will need hospitalization, and you don't even, from those who have been hospitalized, those who need intensive care. And we have only 2,000 beds for intensive care. So what is in fact the meaning of putting these numbers is to show people, be careful so that the hospitals don't become overloaded. Because if they are not placed in the hospital, means people are going to be dying at home. So better prevent than, as we say, than cure.
Yeah, I don't want to take much of your time. I just want to give it to you, then you give us any advice that you want to give it to the people out there, so that when the time reach to take the vaccine, they will not hesitate, and then they just go and take it.
Well, my advice is that people have to trust. You know, for me, our life builds on trust.
That's right.
When you go to a restaurant, I'll give you a very, very stupid example. You don't know how this food was prepared, okay? But you are served and you begin eating. You don't know the conditions of the kitchen. You don't know whatever the raw materials from which this food was made. But you're enjoying it. We call it trust. I would advise people to build this trust. Let us trust our health systems. Let us trust our governments. Let us trust the World Health Organization, that they would never have recommended things that are going to be dangerous to the population. Nobody can do this. Okay? So that's my message. Let us trust that nobody is going to make that stupid mistake of putting millions or billions of people in danger. That who has that crazy plan to exterminate the world? You had the theories that they want to exterminate Africa and they want to exterminate. This is just people's fantasy. Those things don't exist.
Okay.
So trust, take your job, okay? And then our life will become normal. Okay?
Okay.
If everybody is vaccinated. Let us cross our fingers that our government in Africa will be reasonable and that the manufacturers, the companies here are going to be more generous. They're going to supply the vaccines to our countries. Everybody will be vaccinated and then life will come normal. Okay?
That's so great.
So please, take the jab.
Thank you so much, Doctor. Thank you so much for your time. I really appreciate it. I thank you for opening your door for me and the people out there to listen to what you have for us. So, people out there, thank you so much for watching us. That's what our researcher, our doctor has said to me and you. We need to trust. We need to trust the vaccine. So when it's your time for you to go and take it, don't hesitate. You just go and take it, and things will be fine. So that everybody want to come to the normal life, because this mask, this thing we are doing, it doesn't help us.
Absolutely.
So before then, please do take care of yourself. Don't forget to wash your hands, sanitizing. Don't forget to wear your mask. You protect me, I protect you. So at the end, we all be free until the day they will tell us to remove the mask.
Exactly.
Please take care of yourself. Take care of yourself. I thank you for watching. Thank you.